Okay, we're on. We're on. Brilliant.
Oh.
So it is 5:26 and we're going to get started at 5:30. So hello everybody that's already online.
Hi.
Hey. Nice and cozy on this lovely, wet, horrible Tuesday.
Yeah.
It's definitely autumn now, isn't it?
Absolutely.
But do you like my autumn scarf?
I do. I'm very much enjoying the autumn vibes. I'm still clutching at whatever summer we've had.
It's like I'm still going to go floaty and pink.
I'm still going to pretend that we are not in a dirge.
Yeah, it's definitely getting dark now. The clock's going back. It's always tricky.
Well, I always thought that it got lighter though, like in the evening, because we've gone
back in time. Yeah, but it is just getting darker.
But it was literally like 4:30 and it was pitch black outside, and I was like, "What's this about?"
So wherever you are, whatever you're doing, we hope you're snuggly.
Yes.
And you've had a fantastic day at work. It is only Tuesday, so we can't even say it's near the end of the week. So
we're nearly halfway.
We're nearly halfway. Little wins.
Yeah,
little wins. I've got a little win. I'm now at 27 weeks plus 2. I didn't know this. So when they measure your pregnancy, they say like 27 weeks plus a number, and that is the days. So you go 27 plus 3. That's 27 weeks plus 3 days.
That's mental that they can know exactly how many days.
It's based on like the length of the baby. So it's very, very accurate.
Her mum's still growing, mate. My mum's like 26 years and 5.
So it's really exciting that we're doing this. Thank you so much, Laurie, for coming on with me, because normally I do this on my own.
Thank you for having me.
It's great. It's great. So you've got some questions for me as well.
I do indeed.
Okay. So we're going to go through a few questions. Perfect. Sorry, I've just got confirmation that people can hear me. So we're going to go through questions which people have sent in. And if you have anything to add, then just by all means, you can write your question just in the bottom right-hand corner if you are on with us live. We will be doing more of these in the future. So in the future, if you have a burning question you want to send me, please do email it to me. So I don't know if you want to start by introducing yourself.
So hi folks. For those of you who haven't had to endure me yet, my name is Laurie. I'm one of the chiropractic assistants here at Tweed. So as Rose said, we're just going to have a general chit chat this evening. Our topic is going to be about general women's health issues, and obviously focusing mostly on pregnancy. So Rose is going to ask and answer any questions that have already been sent in. Or also, as you said, if you want to pop some extra questions in as we go along, that is also great. So we'd love a bit of audience participation here, trust me.
Yeah, it's always good to get that.
Yeah, definitely.
Just a little thumbs up.
Yeah.
But it's fine. Either one.
Yeah, that's fine. So Rose, so you've been a chiropractor for 6 years.
Yeah.
And so what typically do we see women coming in for mostly? What's the most common issue that you see in women?
Well, the most common issue that chiropractors look at really is the broad one, which is lower back problems, neck issues, headaches, sciatica. But generally, when people come to us, they have other problems as well.
Mm-hmm.
So they have lower energy, they don't sleep very well, sometimes their focus isn't as good as it could be, or they just don't feel as flexible or as mobile as they should be. So women specifically, and women in pregnancy, are that plus a few more complicated things.
Yes, I can imagine.
Just I don't want you to be put off by it.
No.
So a big
no.
So a big thing that women who are pregnant come in with is they get pelvic pain. So that is a condition called SPD, which is symphysis pubis disorder, and that is when the front of your pelvis hurts. And it hurts when you walk, it hurts when you sit, it hurts to roll over in bed. And I'll talk everybody through why that is actually happening. But that is a very common issue which people come to us for. Women, particularly when we're pregnant, or even as we get older, we start to well. So people could start experiencing carpal tunnel syndrome or even tarsal tunnel syndrome, which is exactly the same thing but in the foot.
Right. That's going to be my next question.
Yeah. The heartburn is a real classic one because basically when you're growing a baby, you have don't have much space in your digestion. So you get heartburn. And that is something that chiropractic can absolutely help with as well. So the most common things that in pregnancy is that the lower back starts hurting, they start feeling tired, and then you get all these other extra issues as well. So it's a bank of problems that women can come to see us for.
Okay. So some women, obviously some of you are maybe new to us today. So a lot of people haven't seen a chiropractor before and don't really have an understanding of what we do. And usually they're mostly sent to a physiotherapist or a doctor or an osteopath. Can you explain what we do differently here? So as a chiropractor, what you do? Yeah, the difference between seeing, say, a physiotherapist or an osteopath.
Well, firstly, the go-to in the NHS model is a physiotherapist. They work within the NHS, so most people will be referred to them first. Physiotherapists' main focus is on rehabilitation through exercise, and they work on the soft tissues, which often involves some muscle work or some massage, some stretching, and they'll give a lot of advice. And they'll focus on the area of complaint. You do get some holistic physiotherapists that will look at the whole thing, but generally in the NHS, they will look at just the problem that you've come in with. So if you have pain in your pelvis, they're going to stretch out your adductors, going to stretch out your glutes. They're going to give you exercises to strengthen your glutes, just to help stabilize you. So that's what a physiotherapist would do.
Okay.
An osteopath, basically their model is that if your body is working together as a whole, then your problem will be better. So your pain will go away.
Okay.
So they will look at the muscles, the bones, the tendons, the ligaments, the lymph. They'll look at the organs. They'll look at the whole system, and they'll work on getting the whole system functioning properly. So they'll do that with using their hands, with exercises. They'll do that with advice, lifestyle advice. They'll also some osteopaths use certain techniques like ultrasound. So the approach of an osteopath is fantastic, and it's really similar to chiropractic. Whereas chiropractors, we focus on the connection between the brain and the body.
Right. Yeah.
Okay, which makes us the quirky nervous system people. So our whole principle is that if the brain and the body are connected healthily through the spinal cord and the nervous system, then the body will work to its best. So what we do is we check for subluxations, which is when the bones are misaligned and you actually have interference in the nervous system. We do that through various checks. So we basically check the cranium, which is the skull, all the vertebrae of the spine, and the pelvis. And if we need to, we also look at extremity work. But our focus is starting in and then going out.
Yeah.
So that's what we do differently. But the main thing is that a lot of people only see us when they have a problem.
So when would we be saying that somebody should ask to seek help for their body?
Okay, so it's an interesting question, that. So I would say that the moment you're feeling not okay, I mean, really the answer to that is actually I would always encourage women, particularly women who are pregnant, to be proactive in their health. There's this common misconception that if you're doing any kind of holistic health, then you're treating yourself.
Yeah,
it's like luxury.
Yeah, like going to Stobo or something. Like, yeah, it's like, oh, you're going for a little trip to the chiropractor. You've got to be good to yourself, you know.
And I think that is possibly the reason why women do wait for them to sort of hit the red line, for them to actually struggle, for them to get to the point where their pain or their problem is getting past the point in which they can deal with.
Yeah.
So my answer when you should see a chiropractor, if you're planning on having a baby, is you should be seeing a chiropractor before you've even conceived.
Yes.
Because you want to get your body as healthy and as ready to carry a child for 9 months as in as much in advance as possible. If you are already pregnant, it's completely safe, so you can start at any time. And I would say that going up from your first trimester all the way through will just allow your body to work the best it possibly can. And if you've had babies and you're struggling, or you've had babies and you just think, you know what, I went through a lot with that time, I should really proactively see somebody, then I would say to do that.
Okay, that's great. So
did that answer the question?
Yes, that did answer the question. I can just say from like a chiropractic assistant point of view that when we're doing scans and you talk to people, unfortunately, we do get a lot of people that come to us as a last resort instead of having the understanding that it is something that you can consider to do, even if, like, I mean, although we're not saying do it as a treat, but like do as well. Be good to yourself. Like, you don't have to be like in searing awful pain to feel the benefits of it, do you?
No, absolutely not.
So what we would like to do, so this is obviously the main focus of this evening, alongside other issues, is so would you be able to explain to us what we would do, what the chiropractors would do to help women who are pregnant, like specifically?
Okay, so to answer this, I have got my spine. Okay, and if you're a visual person, this will help. So the first thing that I want people to kind of understand is what the ideal scenario is. So the ideal scenario, if we look at it from a chiropractic perspective, is that we have the cranium, which is the skull, and then you have your cervical vertebrae, which are in this particular model are facing forward. There we go. So you should have a gentle curve in your upper neck, and then a gentle curve through your upper spine, which is where your rib cage is, gentle curve through your lower spine, and then your pelvis should be lovely and level. So if you imagine your hips are here, and this is where your pubic symphysis is, so this is what I was talking about earlier on, that hurts. You want everything to be level. Okay. So the first thing that chiropractors will do, they will check for the movement and the alignment of all of these bones. So we will check the pelvis, we'll check the lumbar spine, thoracic spine, and cranium. Because the body, if you imagine it, if you have an issue down here, this problem will be stuck. This area won't be moving properly. Maybe it'll be twisted. And so we'll go, okay, that's the area we need to focus on. But you can see it's a chain. Yeah. Okay. If you wobble it around, it's clearly a chain.
Yeah.
So if you have an issue lower down, then you will need to unwind the body higher up, and vice versa. So when a woman or a man comes in, we will check for the alignment of the whole body, and we will check for how well the nervous system is functioning, which is the test which you do.
Yeah.
So that is looking at the balance, it's looking at the weight distribution, it's looking at how well the brain knows what the feet are doing, strength, the range of motion. So we'll do all these tests, and then that will kind of give us a summary of how healthy somebody is.
Yeah. And
then we'll get to work on adjusting the specific vertebrae that are not happy.
Yes.
Okay. So in a pregnant patient, we will do things slightly differently, because we have a changing body. So not many, I put on 10 kilograms since I've been pregnant.
It's a heavy baby.
I really hope the baby's on 27 kilograms. So I put on like just over a stone. So in a really short period of time, everything has become very lax. So when you're pregnant, you have a load of hormones going crazy. In fact, anything that happens during pregnancy, you can pretty much put down to hormones. Honestly, it's bizarre. So these hormones are there to relax our ligaments so that we can accommodate a growing baby.
Yeah.
So that as the baby grows, the baby will be growing in this front of your where your uterus is, and as the weight gets heavier, your lumbar spine is going to bend.
Yeah.
Okay, it's going to start to become more lordotic, and as the pelvis has to open as you get further through your pregnancy, you will start to possibly feel lax in your sacroiliac joints, and in the pubic symphysis at the front. But this is all good because your baby is growing, so your body needs to adapt. But if you have an but if you have an underlying issue, so say for example you have a disc issue, or you have been compensating from an old hockey injury, or you've got a slight rotation there which you perhaps aren't even aware of, what will happen is as everything gets more strained and that weight gets more intense, those issues are going to become to the surface. So if you go into pregnancy with an issue, it will start to become more of a problem.
It'll definitely make itself more known.
Yeah, it will go, hello there, Rose.
Nice to meet you.
Nice to meet you. We haven't talked about this for a while.
Yeah.
And if you can imagine, if this is going on lower down, if anyone has any tension higher up, maybe from an old whiplash injury, or even maybe from a repetitive strain from looking at a computer, or maybe their posture isn't so happy higher up, then if the base starts going, then the upper part of the body is going to start showing up, which means you start getting more headaches, or you start having more nerve tension in your arms, and that effectively is going to affect your life.
Yes, I can see how it would. Yes.
Am I putting you off yet?
It's making me think about it a little bit. I think it was when you tilted the pelvis forward. I thought that's going in there. No.
I mean, we won't even talk about the fact that you've got to push a baby out of there.
That's what my head was doing when you tilted it forward, and I saw the space, and I thought, oh no.
Yeah. So but bear in mind that space is pretty occupied. You know, you've got
there's all that stuff in there.
You've got your digestive tract. I mean, that's not empty. You haven't got a bowl. It's a digestive tract. You've got your reproductive organs. You've got muscles. So it's your whole pelvic floor. It's really put a lot of pressure on.
So I can see why that would get excessively heavy and uncomfortable, definitely.
Yeah, so it's got to be pretty perfect.
Yeah.
Basically.
Definitely.
And I would say that any woman that isn't doing like Pilates or yoga or movement or walking is going to make it so much worse. So we're talking about chiropractic from my perspective, but absolutely being proactive with these certain classes which you can do will absolutely help you as well. However, if you have got a problem with your actual nervous system and the misalignments in the vertebra and the pelvis, you're not going to be able to release them yourselves.
Yeah.
Like Laurie, if I said to you, right, I want your L5, I want you to move your L5 a bit more to the right, please. So that's this bone at the bottom.
Yeah.
Can you do that?
No,
I can't either. You can't, your brain cannot change the alignment of your spine. This is a pattern, this is a neurological muscle memory which needs to be retrained and manually readjusted, because the brain will start tuning into that area, then you start getting different muscle patterns firing and everything else.
Yes.
I'll stop with the anatomy.
Okay.
It's late on a Tuesday.
Yeah.
But does that answer the question?
Yes, it definitely does.
Okay. And just to mention, this is your tummy. We've got the diaphragm here. Diaphragm has the esophagus going through it. Everything getting tight here, it's going to start affecting your esophagus, which will be your stomach juices becoming more fiery.
Heartburn. Oh, nice.
And that is, do you know what, there's an old wives' tale which says that if you have a hairy-headed baby, you are going to get more heartburn.
Oh, Mum, I'm really sorry.
It's one of those things with old wives' tales. There is some truth in it, but there is also, it could easily be a bald baby.
Yes. Yeah.
So absolutely, when we see patients in practice, we will do a lot of work on the diaphragm to help with that, and that will be for people who aren't even pregnant. Like if you have heartburn, we can release the diaphragm off and allow the spine to move, so you can not put pressure on yourself.
Because it is so amazing that the things that will, like you say, that will come up as you go through your pregnancy when you're changing and things that you didn't even realize that were wrong with you in the first place. So even if you think, oh, I've got a bit of a sore shoulder, I can tell you from personal experience that just that sore shoulder can be from something that's gone way, way back, that's just not been sitting right for a really long time. So just being seen to and having that nice alignment, and I suppose training it to be like that, It is. It's like training a puppy or toilet training, which is something that's going to be fun. You're training your
body,
to stay in the right place. But it's supposed to be, because a lot of the time it does sit somewhere that it's maybe not meant to, but they like it there. You've trained yourself to be there.
Yeah, it is, and it's because if you imagine, the brain is not built for perfection. It's built for adaptation and survival. So it doesn't make us move in a perfect way. It makes us move in the easiest way. So if you can't move your shoulder, it will start doing the same movement but with your spine.
Yeah.
And if you can't move your neck because you've had an injury, it will twist you, but it will use your lumbar spine.
Yeah.
It won't go time out. You can't move that part of your body. Therefore, that action isn't going to happen. It will find a
way to do it.
Yeah, exactly. And that's how compensations cause issues.
Oh, this came off your spine.
Oh Lord, my elastic bands. So obviously,
that's a great answer. This is what we use to hold spines together.
If only, eh?
Yeah, the ideal. Right. So women are often told their problems will go away once they have birthed their baby, that this is all just kind of a temporary thing. Is this the case?
Short answer, no. That's not the case.
Okay.
The underlying compensations, the underlying inflammation will still be there. You take the weight off of a struggling pelvis, the pain will obviously get better. And sometimes in women, the pain will go away. However, the underlying reason for the problem being there, the pain being there in the first place, will still be there.
Yeah.
It does not just bounce back like an elastic band.
Yes.
Oh, like that's an elastic band.
Why I was there.
It doesn't just ping back. And in fact, there'd be an argument to be had that if you did yoga and you rehabilitated and you slept and you gave your body everything it needed to heal, then after you've had your baby, maybe it would, but you can't do that.
No.
In fact, you enter the most stressful period of your life where you can't sleep, where you're holding a baby, and you're moving your body in different ways, if you're breastfeeding or if you're simply just being a mother and you're having to lift a child up.
Yeah, I mean, you see a lot of, I know personally a couple of people that have got problems here because they don't even realise that they're so used to carrying their baby and holding them on their hip that you're kind of moulding your body a certain way to make sure they're comfortable and they're going to stay there, but so you can still kind of do things at the same time.
I mean, good luck having your pelvis getting back into position when you're having to be a mum straight away afterwards.
Exactly, it's not like you're going to get a nice little time out and like get to.
But do you know what? In some cultures, they do actually talk about that fourth. They talk about the fourth trimester. So if you are pregnant and you're watching this, I'm going to bring this in. As a woman, we feel like we should be super mum. We should be able to do our jobs all the way up to 35, 36 weeks. Or depending on what job you have. And then you're supposed to have a baby, and you're supposed to be able to ping back and look after the baby and carry on with your life. The reality is that your body goes through so much change. You've got to give yourself a break and get that support unit around you when you are in that post-birthing period. Because all you should be doing for 6 weeks after you've had a baby is looking after your baby, feeding it and sleeping. I love, it.
Yes. That's your fault.
I'm clearly a first-time mum.
I'm clearly not a mum.
So you really, I think the big thing with women is that psychologically you put yourself under a lot of stress. And if you are that kind of person that's going to, push through pain, push through issues, at some point, and it'll probably be when the child gets older, your body will scream at you. So if you don't pace yourself through pregnancy and through being a mum, then it is just gonna shout at you at some point. And sometimes our women come in 15 years, after they've had their babies with major issues.
Yeah, because they've not. That's one of our things that we have, isn't it? That it's like you listen to your body when it whispers, so you don't have to hear it scream. And it's kind of one of those things that if you make it become a habit now, it's not gonna be like you're coming to us with this big, enormous problem that is then going to take months and years to solve before you get any kind of real consistent relief. So it's trying to make sure that you start yourself out in a nice, some people would, but you wouldn't run a marathon without training for it and getting yourself physically prepared for it. So it should be the same thing.
And it is a marathon, not a sprint, being a mum. I'm not even a mum yet, and I'm over halfway through, and your body changes all the time. So I would say psychologically, you need to look at it as a marathon, not a sprint, being a mum. But also, because this will get every woman that's either had a baby or is pregnant. When you are in pain and you're not able to do what you want to do, or even if you're just feeling lower energy, not up for your usual life, then you'll start feeling stressed. In the vast majority of cases, people aren't being proactive, so they start feeling stressed, and the cortisol levels, which is the stress hormone, will start going up. And research has shown that as you are actually getting more stressed, it is going to affect your baby. Your baby is going to be more likely to have issues actually being birthed. So your body isn't going to kind of synchronize together because it's not in a rest and repair state. Sometimes it can actually affect your baby development-wise, and can even cause your baby to come early or have a lower birth weight. So this has been researched. So if you are stressed consistently, not like an odd day, like if you are consistently stressed all the way through your pregnancy, then your baby isn't gonna ignore it. It's inside you.
Yeah.
Do you know what I mean?
It's feeding off you. So if you've just got a load of stress going on in there, that's all it's got to get, isn't it? So
that's all it's got to go.
Yeah, exactly. I mean, you're not saying like be going out for a run every day and going and doing gymnastics and trampolining and stuff, but just doing something nice to keep because I mean, you get nice endorphins from doing exercise and going for a walk and things like that. So that's what you need to be. That's what you want to feed your baby. You don't want to feed it stress. You want to feed it nice things so it wants to come out and be happy.
And that comes with massage, that comes with chiropractic, that comes with, doing the breathing exercises and yoga. It just comes, the broad bracket, from self-care. It's going to make sure that your body is not in as stressed state as it would be if your body was in pain and you weren't giving yourself time.
Yes. I agree.
And that goes for all women. Just because we're talking about people who are pregnant, if you have raised cortisol levels, that is going to affect your overall health, just as a side.
I can vouch for that, yes, very much so. If you're going to run around like a lunatic, eventually the batteries are going to run out. My dad always used to say I was like the Duracell bunny, how they've got the ones that have got the rubbish batteries and it doesn't get up the hill, and then the Duracell comes like power it up. And he's probably quite chill. He's probably quite on a good level, whereas somebody's just kind of stuck something in and thought, right, I need to keep going. And that's not good for you. It's very, very bad.
No, it is. That's so true.
This is me putting obviously everything Rose has said into layman's terms. Don't do that. It's not good. And it'll be sore.
Yeah,
forever. Look after yourself.
Yeah, absolutely.
So, although we have focused heavily on pregnancy stuff, we have got a couple of things that we would like to talk to as well about just general questions. Yes. So we actually had a couple of people email us in. So we had a question from a lovely lady who has tried exercising and rehabilitating, but still struggles with a really weak core. So is that something that chiropractic can help?
Yeah, absolutely. Muscles require a signal from your brain to switch on. Muscles don't do anything without a signal being passed from your brain to your muscle. They don't have like little internal brains. Muscles are just meat. So if you've tried the exercise route, you've tried rehabilitation, and you have done the core exercises, you've done the pelvic floor, and you've kept going with that, but you just don't feel like you have that engagement, or that your brain isn't really learning it as a pattern, then absolutely seeing a chiropractor to see where there is interference in that nervous system will help you massively. We don't claim to get you fit, but we do claim that if you are adjusted, your body is going to work to the best it possibly can. And we know that in particularly in pregnancy, there's been a lot of research with chiropractic adjustments and actually pelvic floor contractions. So we know that will have, if you are adjusted in the right area, that will affect how strong and how sequential pelvic floor is.
Yeah.
So yes.
So that is good. That will help.
That is good.
That's good. How it was kind of explained to me when I first started coming, because I, like many people, was very oblivious to what chiropractic can offer you. And I think the way that made me understand is that I kind of my brain's a bit weird, but I kind of picture it like a little like octopus or something. So it's all coming from here and then everything just spans off. So when your body is obviously so used to being in a certain way that it's not supposed to, you don't think that it hurts, but it's just not right. So what Donald, one of our chiropractors, explained to me is that what you do when you're being adjusted, it's like resetting your brain and putting you in the right position. So that kind of, it has a knock-on effect. It's retraining your brain to know how to be in the right position, in the right state. And that's the best way to get all of your muscles and everything working the way they should be, and waking things up that maybe haven't done things for a while.
And there's two things to mention with this, is that we're talking about the brain. I love the octopus thing.
Yeah.
I talk about a plant, but octopus plant, things branching off the center. It's not always in your conscious control. So you can, like, for example, with posture, someone could tell you every day for the rest of your life to sit up straight. You won't do it until your brain receives the signal from your spine that it needs to be upright. And it will do that with a specific adjustment. So when you specifically adjust a segment that is stuck, the brain goes, oh, wait, okay, I'm supposed to move that segment. All the muscles start firing. And then your brain can then coordinate and change your posture with time. Because if you keep doing it, it will subconsciously and automatically learn that new pattern.
Yeah, exactly. I mean, we've got a couple of patients, haven't we, that come in that don't necessarily get pain, but have had issues with their posture their whole life, whether it's just been habit or one person in particular was very tall always and kind of hunched over a little bit. And it's just the way that their brain is learned that's just how you stand. And you know it yourself. I mean, we all remember when we were kids, when your granny used to give you around, say, sit up properly or stand up properly or whatever. You'd always do it. You can make yourself sit there for a couple of minutes, but then when somebody's not looking, you're like, oh, because that's your natural relaxed state. Whereas if you're if you're aligned properly, you don't even have to think about it. It's just you're naturally in the right place. So that's something.
Posture is a big thing because it's to do with confidence, it's to do with breathing. In pregnancy, it's to do with how well you carry your baby. You know, it's actually a massive stamp on who we are as a person. We care about our hair, as a statement, but our posture is a big statement of who we are. So
absolutely.
it is a really important one.
And it's a big part of body language, how you come across to people as well. And I think a lot of people would like to come across as being open. And I think if you're forever kind of curled into yourself, your mind probably starts to do that too. It kind of makes you feel like a little bit more.
That is a well researched thing actually. The more that defensive posture is actually your body being in more of a defense state. So the more confident you are, the more open you are, the more grounded you are, all of this part of the brain will fire and coordinate you a lot better when you are in an upright state.
So that's always good. That's always what you want. Absolutely. And we had another question come through in the email from a woman who has struggled with urinary incontinence. Is this something that chiropractic can help?
The urinary incontinence one is harder to know for definite if we can help. It's certainly worth a try.
Yeah.
There has been research which has said that chiropractic will help with the pelvic floor, which I mentioned. And because when you have urinary incontinence, there's a few different sphincters that are going to be involved. So if the problem is neurological and if the body has the ability to change it, then yes, we can help. However, if the problem is not neurological, and say, for example, there is actually, an infection, or there is actually muscles have been stretched past the point of being able to recalibrate, or if there is actual neurological damage, then, and the body therefore can't heal it, then no, we won't be able to help. So it would absolutely be worth a try to see a chiropractor if you've tried everything else. But it isn't as clear cut whether or not it would help or not. Like anything really, because really, if your body can't heal the problem for whatever reason, then nobody can. Yeah, I can't heal you. Like, I'm not
Don't
God.
tell them.
No, I can't heal you.
You can't heal me.
No, I can't.
No,
I can't. Like, I don't have that ability to heal people.
You can put me in the position to allow my brain and my body to heal itself.
Yes. There we go.
That's the money shot there.
That's the money shot right there.
That's what she's doing over here. That's what all of our chiropractors do, and it's a big thing a big message that we do like to give to people. And you see it everywhere. If you look into chiropractic at all, it's not about pinpointing something. It's not like a doctor and saying that you've got a sore bit and saying, right, I'm going to fix that. It's about training you to look after yourself naturally without having to think, I must do this and I must do that. It's making yourself be bodily aware, mentally as well. I think chiropractic it really has changed my life and changed a great perspective for me. And I think that it's teaching yourself to look after yourself.
Well, you've got two ways of doing it. You can either treat the symptoms or you can adjust the cause.
Yes, exactly.
And treating the symptoms is when you go down the painkiller route, or when you go down the surgery route. That is treating the symptoms. Whereas a holistic approach, which you'll get from reflexology, from a chiropractor, from an osteopath, from a physiotherapist, we support your body get better to heal and be stronger as it should be naturally. So that's what we do.
That's lovely.
Okay.
I like that.
Do you have any more questions?
I think it was no. I think we've covered everything. It was just that. I think your last statement, that last sentence, really. I think that was good. That was a good one to finish on. I think I need to stop waffling because then people will forget what you just said.
No. Thank you so much for staying back and going through this.
It's my pleasure. Thank you for inviting me. I've really enjoyed it.
Well, we'll do another one.
Yes,
we'll do another one. Maybe I'll bring my baby along.
Yeah.
Well, look, thank you so much for watching the live stream that we've done this evening. We are going to save it and pop it on YouTube, so you can re-watch it, or if you have anybody that has any more questions, please do drop us an email at info@tweedchiropractic.co.uk, or if you'd like to come and see us, then please, by all means, give either the Gala Shields or Hoyk Clinic a call. Chiropractic is very safe. And we have got pregnancy cushions that you can lie on.
We've got little ones as well. They're really cool.
So you can lie face down with your bum, no issues. So we are ready for you if you need to see us.
Please do. We're really nice.
Well, you are. No, I'm joking. No. All right, guys. Well, thank you so much for watching.
Thanks for coming to join in with us, and we'll hopefully see you all soon.
Bye.